That's the most important thing. Because look at how much benefit you're getting from that Starecta appliance just by
I'm worried
changing.
about this director.
Yeah, what's the deal with the Starecta?
Why I'm worried, or why I think it's like why it's
First of
beneficial,
all,
or
what?
why I'm worried.
Yeah, what is it? What? How do you use it, and then why are you worried about it?
I usually so right now I'm using like underneath this polo shirt, I have these cheap posture correctors. Are you familiar with them? They pull your shoulders back. That helps tremendously, by the way. That also like that's insanely helpful. It's like the best $50 I've ever spent in my life. Um,
I've used similar. Yeah, they do work.
yeah, you need there is some getting used to. There is like like, you need to adapt for at least 2 weeks, but you have to go through like the uncomfortable period till it feels right.
Sure.
Yeah, so a lot of people just start and say, "What is this shit? It hurts my back. I don't want to use it anymore," and they throw it. But I mean, at least from my experience, once that phase is done, it feels good. Um, so about Starecta, I'm worried about the fact that when I wear it, the space between my upper jaw and lower jaw increases. So, in a sense, there is more vertical space to my tongue, which helps it sit lower instead of pushing against the maxilla, like the higher palate, if that makes sense. So, in that sense, I think that the Starecta, and correct me if I'm wrong, could encourage um, vertical facial growth instead of horizontal. But that's just, what do you think about that?
Well, of course. I mean, if you wear a bite plate that heightens your bite, and if you wear it enough, then your body's going to get used to that position, and that might be good for alignment, and it might acutely solve some of your neurological problems, but it's going to come at a price, and that price is going to be what happens when you take it out. How do you function without the appliance? How do you chew? How do you eat?
You can't.
How do you do anything without it? You become dependent on it, and you're absolutely right. It does add facial length, and it's not ideal for aesthetics. Of course not.
I hear you.
I have the same concern with all removable functional appliances and splints, Gelb appliances, and similar. Um, you get so used to wearing them, and they're so comfortable, and they're great for telling you that, okay, there's something wrong here, because when I reposition like this, all of a sudden I feel better. There's an underlying issue here. But the trauma of going in and out of it, the seesaw of feeling good and then taking it out and having all of that discomfort and misalignment rush back in, it's very distressing. And in some ways, it's worse than not wearing anything at all. Um, which is why I like permanent solutions to these things. I like someone like Dr. Yusefian's approach, where, yeah, he gives you the splint, which is the ApnoMed or the Apno TX. It's a removable appliance that corrects the position of your jaws, but at the same time, he's working on a permanent fix, which is actually expanding and doing orthodontics on you and getting your bite right. And the
Expanding
functional
in what
appliance
way?
is slowly phased out.
Expanding forward or expanding like horizontally?
Well, of course, the lion's share of the expansion is horizontal, because that's where the sutures are, right? You can split the mid-palatal suture with an MSE. He splits the mandible as well with the dame and expands the mandible, which is really remarkable. But yes, it's lateral. Any forward expansion that Yusefian is doing, and any forward expansion that anyone is doing, apart from face mask and double jaw surgery, is going to be dentoalveolar, which means pushing teeth. And he does have an appliance that anchors on the MSE and then pushes the front teeth forward a bit. He calls it the Done. He demonstrated that in the interview I did with him. It does give some significant forward expansion, and it's better than something like um, an acrylic expander, or God forbid, an AGA, because what those appliances do is they push off of the back teeth into the front teeth to expand the front teeth forward. And what happens is the back teeth end up going back a bit. Yes, the front teeth go forward, but the back teeth go back because you're pushing off the back teeth. And, Newton's third law, for every action, there's an equal and opposite reaction. Dr. Yusefian's appliance uses the MSE TADs that are screwed into the roof of your mouth as the kind of the platform that he's pushing off to advance the upper front teeth. So it's a unique expander. To answer your question again, in summary, it's mostly transverse, left, right, but it's to some degree forward through dentoalveolar expansion.
I understand. Is it, I mean, just thinking um, intuitively about it, pushing teeth forward doesn't seem like a very good idea, but I might be wrong. I mean,
No, it's not a good idea. And God knows my channel is anti-dental expansion, right? Uh, one of the big theses of my channel is expand the bone, not the teeth. But I've also always said tooth-borne expansion can be the sauce to the meat, right? It's tooth-borne expansion is okay as the icing on the cake, but the brunt of it should be the cake itself, should be the meat, not the sauce. So a little bit of tooth-borne expansion is okay sometimes, right? As long as it's done intelligently. Is the way Dr. Yusefian does it prudent? I would suspect that it is, just because he's such a prudent, experienced guy and he knows better than to aggressively expand teeth. And again, inherently, it's different than other tooth-borne expanders because it's not leveraging the back teeth to expand the front teeth. So it's got certain things going for it. Most importantly, the fact that the heart of the expansion is occurring at the mid-palatal suture with the transverse expansion. And so there's less of a temptation to get greedy with the dental alveolar expansion because you're getting so much damn expansion elsewhere that you don't need to be greedy with it. You can just move the front teeth a little bit, keep them in the bone, open the barn doors a little bit, so to speak, get a little bit more forward tongue
how much
space.
do you think, how much forward can we go, in your opinion? Like safely go?
I don't know. The MSE
Roughly
itself,
speaking.
the
Mhm.
MSE itself is going to expand you forward 1 to 2.5 millimeters, 1 to 3 millimeters, and then with some responsible tooth-borne expansion, maybe another 2 or 3.